see where the conversation takes us.
Okay.
Fun. This is fun. I like doing stuff like here.
Hi, this is Eric Durek, and welcome to our edition of Med Health Fit, the TV show that integrates wellness and healthcare. And tonight, I have the absolute pleasure of having my good friend, my mentor, and fellow wellness personality, Dr. Bob Hopper from Hopper Insurance. Welcome tonight, Bob.
Thank you,
and
Eric.
First
Glad to be
and
here.
foremost, I'm going to do is make a plug for your book.
Good, we like that.
Dr. Bob Hopper, Stick with Exercise for a Lifetime, and you have been one of the most energetic people that I know who has put together a philosophy of how to get people to stay active over their lifetime. And I'm going to discuss that as we go into the show. But your main thrust here in Santa Barbara is that you are the owner and CEO of Hopper Insurance Services, and you offer health insurance, you offer life insurance, you offer a number of different things to people. How did you get started in that business? Tell me a little bit about the transition that you've done in your career.
Well, I always tell people, be careful of the part-time job that you choose, because it could end up being a career. Before I moved up here to Santa Barbara, I was in Los Angeles, and I had a very thriving business setting up wellness programs for Fortune 500 companies. And it was really good, and then all of a sudden a recession came along and companies stopped doing it. And so I had to decide whether I'm going to start over in Pasadena, where I was living, or start over in Santa Barbara, where I'd been a lifeguard at the beach a number of years before that. So I decided to go to Santa Barbara, and I needed a part-time job to hold me over until I figured out what I was going to do. So I got a part-time job selling individual health insurance. And I think it was really fun, and I couldn't quite figure out what I wanted to do, and my insurance business grew, and pretty soon I had a nice thriving business in insurance, and it became a career, and I've had a ball ever since.
Okay, and it's been what, how many years now, 25?
25 years on my own, and another 5 years before that with an agency, so yes.
Fantastic. Wow, time goes by, because I remember that I think I started you out as my insurance agent before my daughter was born, and she's 24 now. So
and
anyway.
we share a birthday, so.
That's
yes.
right, you do share a birthday. So you have a background in health promotion, as you said. You've worked in corporate wellness. You've written books like this one. I want to make, in this episode, a link between a person's lifetime wellness habits, whether it's nutrition, meditation, exercise, walking the dog, whatever it is, and their insurance policy. Because as we've seen in the past couple years, insurance is this nightmare. I mean, it's Obamacare, it's Trump care, it's all of these types of things, and people are very nervous about this risk management that is their insurance policy. And I've never been a big fan of Obamacare, but I understand that it's almost, I'm not going to say a necessary evil, but what I'd like to do is to get your take on why Obamacare, why the ACA, what's this important, and then sort of a transition into is what people think about insurance, and what the industry really helps them with.
Yeah. Well, the reason for Obamacare, or I don't use that term so much as the ACA, or
I
the
like that
Affordable
one,
Care Act, the reason was that people were being underwritten medically, and they were being declined for insurance because they had a health condition. I remember vividly one day a woman comes into my office with her daughter, and we do an application, and I had to tell the woman that her daughter couldn't get coverage because she had asthma. And the woman said, well, can we just exclude asthma? No, we couldn't do that. Well, I'm not worried about asthma, I'm worried about her getting hit by a car or something serious. No, we can't do that. So there have just been thousands, hundreds of thousands of cases where people were declined because of medical conditions. So the Affordable Care Act, the main reason for the Affordable Care Act was that it allowed people to get health insurance without medical questions. So that was the reason for all of it. And then the political side of it is they included a lot of other things And they also included the expansion of Medi-Cal or Medicaid nationally. So then it became a much more political beast. But the major reason for it was getting people with pre-existing conditions allowed to be in the program. Now, here's the drawback. Theoretically, if you have let's say 100,000 people, the first 100 people that theoretically would apply would be those who need heart transplants. The next 100 would be liver transplants, the next 100 kidney transplants. All these very expensive, ongoing expensive.
Right.
Those were some of the first people to join the plans. So the insurance companies normally had low-risk people. Now they had very high-risk people.
Right.
And the government was able to support some of that through subsidies to the insurance companies so they could pay these excessive claims. That's sort of going away, and that's where we're at right now, that the insurance companies are dropping out. Aetna and United Healthcare, number 1 and number 3, dropped out, and Anthem is dropping out.
Just recently.
Yep,
right.
in the individual market, because there's not the financial supports, and the insurance companies are losing billions of dollars trying to do insurance plans.
All right, so through that attrition, do you think that Aetna, Blue Cross, et cetera, are going to actually sort of morph into a pseudo Medicare type process? Because if they can't afford it, they can't make money, and they say we still have to cover these people, why don't we just, we're partnering with the government at a certain level anyway, will they sort of morph into a kind of a pseudo Medicare type process?
No, I don't think so. The individual health market is a small portion of all the health insurance, and the employer-based market is huge, and they make, that's their bread and butter. They basically make some money on individual health insurance, but they make the lion's share on providing group health insurance to small, medium, and large, and very large companies. And that will probably continue.
Well, as we mentioned before we went on air, one of the things that I told you about my health plan with a very large employer, with the largest employer in the county, and what most people don't know is that the University of California is actually the second largest employer in the state of California. They have 168,000 employees, over 10 universities and 2 research labs. And when I started at the university, they had no deduction from our payroll for insurance, and then it was 2%, and then 4%. I think we're up to 6 or 7% right now, and I can really feel that. I can, in my paycheck, I look at the numbers and I say, wow.
Yeah.
So every year or every couple of years or so, there's a little bit, that they're taking more and more out. So they're trying to spread that risk around too. But I see that at some level, people are going to say it's too much money.
It's gotten to the point where it is really too much money. Young people before the Affordable Care Act were paying under $100, like $85 for a major medical, high deductible health plan, and now they're paying $250. So the younger people really ended up having a much greater premium increase. So younger people who are healthy don't join the insurance pool, and that makes it harder for the insurance companies to make money. And all of this can be traced back to some very uneducated choices by our legislators. And you never know why they do things, but our association, the National Association of Health Insurance Underwriters, submitted a lot of recommendations that explained why all this was going to happen, and there was too much political agenda, so it didn't happen.
Well, we see a little bit of the political agenda here recently when John McCain had his surgeries and whatever, and as a person who's a senator, he gets free health care for life, and so he can have as much medical intervention as he needs, and it's not going to come out of his paycheck. So I see that there's a political overtone there, but one thing about the ACA is that, for 10 or 12 or 13 years, my older brother, who lives in a small town in Michigan, had no insurance. He just didn't go to the doctors.
Yeah.
The employer that he worked for did not offer any insurance, and he didn't make enough money to pay for it. So he just was not part of the thing. So his latest job right now, he actually does get health insurance, first time in a long time. So he pays a little deductible from his insurance, or from his paycheck, but he's happy that he actually can do that now. So I think that's one benefit. I wanted to read something that we also spoke about before we went on air. I read a post recently on Facebook of someone who is probably one of my many health and nutrition friends on Facebook said that the best form of health insurance starts in the kitchen. What are your thoughts of healthy diet and good exercise in terms of lifelong risk and insurance premiums?
Well, I guess I've always been an advocate that exercise is something that everybody should do. It reduces the risk of heart disease, cancer, stroke. It lowers blood pressure, cholesterol. It does all sorts of wonderful things.
Right.
So I think regular exercise, and it also helps you lose weight. But on the other side of it, eating and what we eat and the quality of the food we eat and the size of the portions all makes a big difference as well. So if someone, I've heard a lot of physicians say that overweight is our biggest problem in America, that we have a very overweight population. And most of that is probably due more to eating than it is to exercise, lack of exercise. I think people tend to eat too much. I've had to learn as I get older how to eat more frugally compared to what I did when I was younger. And
Well, you were a big athlete in college. I know you were a big swimmer. I'm sure you burned a lot of calories.
I could eat and eat, never gain a pound. Actually, I had to eat extra not to gain weight.
Right. I was in that same boat myself in college. I remember having protein shakes, 1,000 calories sometimes.
Yeah. So you had to have all that extra calories. But a combination of good nutrition habits and exercise is probably at the core of any type of wellness program that you want to do.
But in terms of, and this is going to lead right into the next question, your thoughts on lower premiums for healthy lifestyles. And we spoke as we were getting ready about companies who offer health club memberships to their employees, companies that offer stress management and chair massage and learn at lunch programs like, out at the university, they have all kinds of those things. And if you participate in these, like in the Affordable Care Act, they have some provisions in there for participating in wellness programs, and the employer can actually get some benefits, up to 30% across the board for some programs, and up to, I think, 40% for smoking cessation and weight loss, because they consider those the two largest risks. So you're putting on your insurance cap now, from an insurance provider as you are. Is this something that you'd love to see all of your people be involved with?
Well, you mentioned the one book that I wrote, and I also wrote a second book called The HSA Strategy, The Future of Health Insurance in America. And
I have to get that book.
Wrote that back in 2005, and it's never been truer than it is today. So let me just briefly explain it. I think that most people should start. Their default position should be to get a major medical plan, a high deductible plan with a $4,000 or $5,000 deductible. And it's very affordable. And they should self-insure their doctor visits if they're taking an occasional prescription or something like that. People who have ongoing conditions should have an option for another plan that might have some copays for doctor visits and prescription drugs. But here's a surprising figure. About 73% of Americans spend less than $500 a year on health care. And a very small percentage, 3%, account for almost 50%, or they do account for 50% of all of the healthcare expenditures.
Right.
So we have some conditions like heart disease and asthma and depression and congestive heart failure. These are serious medical problems that dominate the healthcare costs. And most people are pretty healthy. So I think that most people would be better off buying a very affordable plan that covers them from the big risks and then self-insure the small risk. Now, if the employer wants to provide a better benefit, then the employer can put money into a health savings account.
Right. They're kicking in a little bit of...
Now, I think if they would just expand health savings account a bit, it would solve a lot of our wellness dilemmas. If you want to go to a weight control program or any type of weight control program, you can use HSA dollars. I think it doesn't quite work for all of fitness, but we need to have fitness memberships where you can use HSA dollars. When you meet with a psychologist to talk about cholesterol, blood pressure, psychological problems, that can use HSA dollars. So you basically have a fund of money the employer is giving each employee a fund of money that the employee can choose how they want to use it.
And I think that that is a wonderful thing. I mean, what you're describing is exactly what I have.
Yeah.
My wife and I have, higher deductible, lower cost up front, because we're still, at our ages, we're still at low risk.
Yeah.
And, we've had one family member who had a health condition, but for the most part, looking back over the last 20 years, we've spent very little on major medical issues.
Yeah.
And so I think that's a good thing. So, but I'm still, I'm still, hopefully in my career, the next 10 years or so, I will see more employers look at the benefits of wellness as something that they can provide for their even small and medium-based companies. Because I think in the long run, when you started in your career, there wasn't 20 years of data, because you were at the forefront. And when I started my career, I think that corporate wellness was, in its first decade.
Yeah.
And so now here we have from the 80s, the 90s, maybe late 70s, but the 80s, the 90s, we have 35, almost 40 years now of corporate wellness. And I think some programs have just been spectacular. And one program I spoke about with you earlier before we went on was the Silver Sneakers program, which is not an employer-based program. It's a senior citizen program that is funded in part through Medicare, Medicare Plus Choice, Medicare Advantage, et cetera. And they will give free exercise programs to senior citizens, 65 or older, who are a part of a network of health clubs across the United States.
Yep, it's a wonderful benefit.
It's a wonderful program.
We sell individual, we do group health insurance, individual health insurance, life insurance, and Medicare supplements. And when people are buying Medicare supplements, the two carriers that we represent here in Santa Barbara right now both offer the Silver Sneakers program. So it's a very, very popular benefit, and it does help get people out to exercise.
Well, I remember earlier in my career when I was working at one of the local health clubs, we had a health insurance-based program at the club, and it was so successful that the health club was actually losing money because they didn't amortize the cost of towels and time in the shower, the amount of parking spots that would be taken, et cetera, et cetera. And it was, even though it was off-peak hours, it was still, So I think that they've worked out some of the bugs in that in the last 15, 20 years. And again, I see that as really a shining example with more on the way. I know that there are some work comp programs that are moving in that direction, et cetera. So in general, you're in favor of any type of wellness lifestyle provision, because in the long run, it saves healthcare dollars.
Yeah. Especially for large corporations where they might have a big population of people with a particular medical condition, and they can impact those people and save money or save money on claims. Yes, it's really a good thing. In the small group market for employers from 1 to 100, the rates are set, so whether a company does a wellness program or not, there's no change in the premium.
Okay.
But I think the employer, and this is why I keep coming back to this idea of health savings account. The majority of employees are very healthy, and they don't need to have these expensive plans with copays that they rarely use.
Right.
They would be better off having that money in their health savings account, and then for them to have the choice of using that money for their own personal wellness program. And that's why I was saying, if they're talking about expanding the HSA limits, doubling them so people can put a lot more money in there, making a fitness membership something you can use your HSA plan for. I think in that way we can get a lot of people making individual decisions, and the employer is not having to take an active role, which you can't do at the smaller level.
Right.
But it's saying, here's some money to help you, the employee, go out and get healthier.
Well, let me give an example of, we had a large health plan that we worked with years ago. And with such a large organization that I was involved with, their main access to the staff, to the employees, was through the internet. what was great for someone like me, because I could log on every day and I would have an email from this company saying, hey, did you fill out your health risk appraisal? If you fill it out by the end of the month, you'll get a $75 gift certificate. And they really tried to promote certain things that they were doing. But one of the things that I found is that certain unions didn't want to be involved, and certain night shift people, which was in our organization about over 25% of the workers, didn't have access to the computer, so they were really sort of left out of that aspect. So when I say that a lot of health processes in the United States are going into the internet, like fitness programs, you can log onto YouTube and you can get thousands of fitness programs.
Yeah.
You can get recipes, you can get motivational things, you can get behavioral health, you can get anything online that you want. And a lot of these companies offer it right off their website. But in terms of servicing everyone, is there an issue with sort of the online community? Because one of the things that I found, and I'll let you answer in just a second, is that after a while getting those emails to me kind of turned me off. And I was actually not as compliant with that program as I would have been with a face-to-face. A learn at lunch program or a recipe or a walk at noon or something. They didn't have those. Everything was online. And I think that they might be missing a little bit of their target market. Can you elaborate on that?
Well, I think the personal touch really works. So having classes and activities, yes, I like that. Having a computer monitoring your behavior and asking you questions, trying to emulate another person, I don't think works as well. So I sort of have a mixed bag on that. But if I were to, I think education, giving people good, solid education about a topic, and like for example, my book was Stick with Exercise. I give people a nice philosophy on what it takes to stick with exercise. And if I could say it in a few words, people who are involved in activities that they think are fun to do don't have a problem sticking with an exercise program. And people who think of it as work and torture, they have a hard time. And ironically, or paradoxically, I'm not sure which one, if someone gets involved in a fun activity, like tennis or golf or swimming or biking or skiing or racquetball or whatever, and they really like it, they're going to have an additional motivation to go get in shape.
Right.
So you're going to find that I think, if I were to put it easily, your first goal is to find something that's fun to do that you get hooked on.
And that's the basis of your whole book was find fun first. Don't worry about getting in shape.
And then if you take lessons so you can learn the skills, you join a group so you can be part of a team, and you set regular times, you're going to get so hooked on it that then you're going to find yourself, maybe I'll go to the fitness center for an hour or so, a couple times a week. I know I'm not a real advocate of fitness programs, but I go regularly because I love to ski. That's what gets me to the fitness center. I'm an avid skier and I love it. And so I found something that was fun. And back when I was in Pasadena, I was an avid tennis player and swimmer. So you find reasons, fun things, and then you've got a reason to do it and do the hard work.
I just, when I was a kid, I started lifting weights. I mean, when I was really young, 11, 12 years old, I started lifting dumbbells down in my basement in the Midwest, and I've just been lifting weights for now almost 50 years.
Yep.
And I look back at it, it's like, oh my God, I've been doing this a half a century. And I look at all these guys when I was a kid, Arnold Schwarzenegger and Frank Zane and all these guys who are bodybuilders. They're 75 years old now, and they're still lifting weights. Yeah. So I see sort of this first generation of people from the 60s and 70s who were either in the aerobics. Jane Fonda is almost 80, and she's a Hollywood person, but she still is in really good shape for someone who's pushing 80. And a lot of it, Raquel Welch, she was a big yoga person. She's almost 80. All these people now are getting into being, the grandparent age, and they are different than my grandparents who never did any exercise. They worked on a farm, or they worked, whatever they did during the Depression, that's what they did. So I'm hoping that this generation of people really kind of can look at what they've done over their lifetime and say, well, I enjoyed that. I never have said in my lifetime that whatever exercise that I did, that I really hated it.
Different people like different things. You enjoy weight training. So, I would say if you enjoy weight training, that's great. Make that your lifetime sport, and then you might find, if I get in really good shape, I can do better on my bike. And I know I think you set a world record.
Well, I didn't set a world record. I attempted a world record in my 40s because it was a challenge, but I also knew that I had a background in fitness that would allow me to, if I just kept pushing. And again, and the biking is something that I never did as a child. In high school, I was a runner. I was track and field. I was basketball, whatever. That's what you did in the Midwest. Nobody was a bicyclist in Michigan back in those days. But anyway. So my last question here. We've got a couple minutes to go. Should health plans be able to dictate the cost of prescription drugs that doctors prescribe? Do you think that there should be a little bit more of a, because I know that Medicare actually has not been very successful at that.
That's opening up a big can of worms.
Yeah, and we only have 2 minutes to answer.
So let me close out by this. I think I can make a really good case for probably 70% of Americans that they should get a high deductible health plan and a health savings account. And they should put money in that health savings account to pay current expenses, plan for future, including retirement, which people are shocked when they find out they're going to spend nearly $250,000. Like the average for a couple from age 65 to final years is $250,000. So we need
medical expenses.
On medical expenses. We need to educate Americans to get away from the dependence on copays and to begin saving money for the big expenses. Now that they're saving money, they have some money in there that they can use on a tax-free basis to incorporate into wellness activities. And I hope in the future that the health savings accounts become more liberal. So we have the basis of a program, and I hope employers take a look at this and say, well, I want to encourage my employees to join the fitness center, and I'm going to give them an extra $75 a month. They can either put it in their HSA and use it for future expenses, or they can pay their fitness.
Well, I mean, we won't talk about prescription drugs, but I'm saying that if people plan better in their 40s, in their 70s when they're retired, they may not need all these prescription drugs, because I see that as a huge problem in the United States right now. So you're right. So I guess in summing up here, planning well in your 30s and 40s when you're healthy.
And leverage your good health.
Right.
Leverage your good health to save a lot of money so that you can build for the future, have security.
Well, the book, which I'm sure is on Amazon.
It's on Amazon.
Stick with Exercise for a Lifetime. Dr. Bob Hopper. He is the president of Hopper Insurance here in Santa Barbara. What a great time we had tonight. And I can hear the music in the background, so I'm gonna. Do you have a website that people can go to?
It's just Hopper Insurance Services.
HopperInsuranceServices.com. And for MedHealth Fit, this is Eric Durack. On behalf of our guest, Bob Hopper, thank you for tuning in, and we'll see you next time here on MedHealth Fit.